Hello, my name is Susan Blank, and I'm an endocrinologist who works with the Virginia Department of Health. Thank you for joining me for this learning session, which is part of the Virginia Healthy Hearts Initiative. Today, we're going to be reviewing best practices for checking blood pressures in the clinical setting. We're going to start with a brief discussion of how to interpret blood pressure readings, move on to review the best practices for checking blood pressures and how to check a manual blood pressure, and then finish by discussing the impact of common blood pressure measurement pitfalls. As you know, the blood pressure is made up of two different numbers. The top number is the systolic blood pressure, which reflects the pressure in the arteries when the heart is contracting. And the bottom number is the diastolic blood pressure, which reflects the pressure in the arteries when the heart is relaxed. Current guidelines put the blood pressures into three different categories. It's considered normal blood pressure if the systolic blood pressure is under 120 and the diastolic blood pressure is under 80. It's considered elevated blood pressure if the systolic falls between 120 and 129 and the diastolic is under 80, and it's considered high blood pressure or hypertension if the systolic is 130 or above or the diastolic is 80 or above. It's also very important to know that if you ever get a reading that is over 180 systolic or over 120 diastolic, it may be a medical emergency. If the patient is having any symptoms, call 911. Concerning symptoms can include chest pain, shortness of breath, headaches, vision changes, and numbness and weakness. Even if the person is not having symptoms, it's something to take very seriously. You want to have them sit quietly and recheck. And if the reading still remains elevated over 180, over 120, then you want to contact the person's primary care provider for guidance immediately. Now we're going to move on and discuss best practices for checking blood pressures. To start, it's important that you have the right equipment. You want to use an upper arm device because these are more accurate than wrist and finger devices. It's also very important that you use a validated device if you're using an automated cuff. The American Medical Association has a very helpful website called validatebp.org, which lists all of the devices that meet their quality and accuracy standards. It's also important to use the correct size cuff for the patient's arm. You can check to make sure that you're doing this with the index line and range lines on the blood pressure cuff. If you put the cuff on the person's arm and the index line falls within the range lines, that is the correct size cuff. If the index line falls on this side of the range lines and there's a lot of cuff left over, it means that the cuff that you're using is too large and you need to size down. On the other hand, if the index line falls on this end of the cuff and there's just a little bit of the cuff left, that means that you're using too small a cuff and you need to size up. There are a few things that should be done in preparation for checking a blood pressure. Ideally, for 30 minutes prior to having their blood pressure checked, patients should avoid caffeine, alcohol, smoking, exercise, and eating because all of these can affect blood pressure. It may be too late by the time the patient gets to you, but you can at least educate them for future blood pressure checks and make a note of it next to their blood pressure. You should have the patient empty their bladder if needed. A full bladder can add up to 10 points to the systolic blood pressure. And it's also very important to have a patient rest quietly in a chair for at least 5 minutes before their blood pressure is checked. Skipping this step can add 10 to 20 points to a systolic blood pressure. For proper cuff placement, the cuff should be placed on a bare arm, not over clothes. And the cuff should be placed on the upper arm with the bottom edge of the cuff approximately 1 inch above the crease of the elbow. The artery index marker, which sometimes looks like this with a line and an arrow, other times it'll look more like this, should be aligned over the brachial artery. And the brachial artery, you can see drawn in here, runs right down the center of the inner arm. And the fit of the cuff should be snug but not tight. When the cuff is deflated, you should still be able to fit 2 fingers between the cuff and the arm. Proper positioning is also very important. The patient should be sitting in a chair, not on the exam table. Their back should be supported. Their legs should be uncrossed with both feet flat on the floor, and their arms should be supported on a flat surface with the palm facing up and the cuff at heart level. You should ask the patient to sit quietly and not talk while their blood pressure is being measured, and then record the blood pressure reading along with which arm was used to take it. If you're using repeat measurements, you want to wait 1 to 2 minutes between readings with the patient sitting quietly and the cuff fully deflated. And then after you're done, you want to wipe down the cuff and any other parts of the device that might have touched the patient with an EPA-approved disinfectant and allow the device to air dry before using it for another patient. If you're taking the blood pressure with a manual cuff rather than an automatic cuff, you'll put the diaphragm of your stethoscope over the brachial artery right below the lower edge of the blood pressure cuff. Then you'll pump up to around 30 millimeters of mercury over the patient's normal systolic blood pressure. If you don't know the patient's normal blood pressure, a good place to start is usually around 160 to 180 millimeters of mercury. Then you can deflate the cuff slowly at a rate of around 2 millimeters of mercury per second and listen closely for the carot cough sounds, which are the sounds of the pulse in the brachial artery. You'll make a note of the first carot cough sound, which represents the systolic blood pressure, and then the point at which all of the carot cough sounds disappear, which represents the diastolic blood pressure. It can be very tempting to skip some of these steps, especially in a busy clinical setting, but they really are all important for ensuring an accurate blood pressure reading. This graphic looks at the potential impact of failing to follow some of these best practices. If a patient is talking or even just actively listening while their blood pressure is being taken, it can add 10 points to the systolic blood pressure. Using a cuff that's too small can add between 2 and 10 points to the systolic. Putting a cuff on over clothes can have a major impact depending on the thickness and bulkiness of the clothes. It can add up to 50 points to the systolic. An unsupported arm can add 10 points. Crossed legs can add between 2 and 8. An unsupported back or feet can add 6. And a full bladder can add 10. So you can see that if you fail to follow all of the best practices, you can end up with a blood pressure reading which is significantly above what it actually should be. This concludes today's learning session. Thank you very much for your time and attention. I hope it has provided a helpful refresher on best practices for checking blood pressures. If you're interested in additional resources on high blood pressure or heart health for yourself or your patients, I've included the address for the VDH website along with a QR code that will take you there. Thank you very much and have a great day.